The Sleep Sanctuary, Mastering Your Sleep for Optimal Health and Well-Being. Chapter 1. The Vital Role of Sleep. Sleep. It's something we all do, or try to do, every single night. Yet, despite its universality, the profound importance of sleep for our overall health and well-being is often underestimated. We live in a culture that often glorifies busyness and productivity, sometimes at the expense of adequate rest. This chapter will delve into the fundamental reasons why sleep is not just a luxury but an absolute necessity for a thriving life. The restorative functions of sleep, body and brain renewal. Sleep is not simply a period of inactivity, it's an active and dynamic process during which our bodies and minds undergo crucial restorative functions. Think of it as the body's time for maintenance and repair. Physical restoration. During sleep, our bodies engage in essential processes that contribute to physical health. Tissue repair and growth. Sleep is crucial for muscle repair, tissue growth, and cellular regeneration. Growth hormone, essential for these processes, is primarily released during deep sleep. This is why adequate sleep is vital for athletes, children, and anyone recovering from injury or illness. Immune system boost. Sleep plays a critical role in strengthening our immune defenses. During sleep, the body produces cytokines, proteins that help fight infection and inflammation. Chronic sleep deprivation weakens the immune system, making us more susceptible to illness. Energy conservation and replenishment. While we sleep, our metabolic rate slows down, allowing the body to conserve energy and replenish its stores. This energy is then available to fuel our activities during waking hours. Mental restoration. Sleep is equally vital for our cognitive function and mental well-being. Memory consolidation. Sleep plays a crucial role in consolidating memories, transferring them from short-term to long-term storage. This process is essential for learning and retaining information. Studies have shown that sleep deprivation impairs memory and cognitive performance. Brain detoxification. During sleep, the brain clears out metabolic waste products that accumulate during waking hours. This cleansing process is vital for maintaining optimal brain function and preventing neurodegenerative diseases. Emotional regulation. Sleep significantly impacts our mood and emotional regulation. When we are sleep deprived, we are more likely to experience irritability, mood swings, and difficulty managing stress. Adequate sleep promotes emotional stability and resilience. The impact of sleep on cognitive function, mood, and immune system. The effects of sleep extend far beyond simply feeling rested. It has a profound impact on various aspects of our health. Cognitive function. Sleep is essential for optimal cognitive performance, including attention and concentration. Sleep deprivation impairs our ability to focus, concentrate, and maintain attention. Decision-making and problem-solving. Lack of sleep can hinder our ability to make sound decisions and solve problems effectively. Learning and memory. As mentioned earlier, sleep is crucial for memory consolidation and learning new information. Mood and emotional well-being. Sleep plays a critical role in regulating our emotions. Mood regulation. Sleep deprivation can lead to increased irritability, anxiety, and depression. Emotional resilience. Adequate sleep helps us cope with stress and manage challenging emotions. Immune system function. Sleep is essential for a robust immune system. Immune cell production. Sleep promotes the production of immune cells that fight infection. Inflammation regulation. Sleep helps regulate inflammation in the body. Chronic sleep deprivation can lead to chronic inflammation, which is linked to various health problems. The long-term health consequences of chronic sleep deprivation. The consequences of consistently not getting enough sleep can be severe and far-reaching. Increased risk of chronic diseases. Chronic sleep deprivation is linked to an increased risk of several serious health conditions including cardiovascular disease, heart disease, high blood pressure, stroke, type 2 diabetes, impaired glucose metabolism and insulin resistance, obesity, hormonal imbalances that affect appetite and metabolism, mental health problems. Chronic sleep deprivation can exacerbate or contribute to mental health issues, such as depression, increased risk of developing depression and worsening existing symptoms. Anxiety disorders, increased anxiety and difficulty managing anxiety symptoms. Reduced quality of life. Chronic sleep deprivation can significantly impact overall quality of life, leading to reduced productivity and performance, impaired cognitive function can affect work, school, and daily activities. Increased risk of accidents and injuries. Drowsiness and impaired reaction time increase the risk of accidents, particularly while driving. In conclusion, sleep is not merely a period of rest, it's a fundamental pillar of health and well-being. It's a time for our bodies and minds to repair, restore, and rejuvenate. Prioritizing sleep is not a sign of weakness, it's an investment in our physical, mental, and emotional health, allowing us to live more vibrant, productive, and fulfilling lives. The following chapters will provide you with the knowledge and tools to create your own sleep sanctuary and unlock the transformative power of restorative sleep. Chapter 2. The Sleep-Wake Cycle, Circadian Rhythm. Our bodies operate on an internal biological clock, a roughly 24-hour cycle known as the circadian rhythm. This rhythm governs a wide range of physiological processes, including sleep-wake cycles, hormone release, body temperature regulation, and even digestion. Understanding this internal clock is crucial for understanding and optimizing our sleep. The circadian rhythm and its influence on sleep patterns. The circadian rhythm acts as an internal timekeeper, orchestrating our sleep-wake cycle in response to environmental cues, primarily light and darkness. It dictates when we feel alert and awake and when we feel tired and ready for sleep. The master clock, the suprachiasmatic nucleus, SCN, a tiny region in the brain's hypothalamus, is considered the master clock of the circadian rhythm. It receives information about light exposure from the eyes and sends signals to other parts of the body to regulate various functions. Daily rhythms. The circadian rhythm influences a variety of daily rhythms, including sleep-wake cycle, the most obvious effect, dictating periods of sleepiness and wakefulness. Hormone release. The timing of hormone release, including melatonin, promotes sleep, and cortisol promotes alertness. Body temperature. Body temperature fluctuates throughout the day, typically being lowest during sleep and highest during the afternoon. Appetite and digestion. The circadian rhythm also influences appetite and digestive processes. The role of light and darkness in regulating the circadian rhythm. Light is the most powerful external cue, Zeitgeber, that synchronizes the circadian rhythm. Light as a Zeitgeber. When light enters the eyes, it sends signals to the SCN, which then inhibits the release of melatonin, a hormone that promotes sleep. This is why exposure to bright light during the day helps us feel alert and awake. Darkness and melatonin production. Conversely, when darkness falls, the SCN signals the pineal gland to produce melatonin. Melatonin levels rise in the evening, promoting feelings of sleepiness and preparing the body for sleep. The impact of artificial light. The widespread use of artificial light, particularly blue light emitted from electronic devices, can disrupt the circadian rhythm by suppressing melatonin production. This can make it harder to fall asleep and lead to poor sleep quality. The influence of hormones like melatonin and cortisol on sleep. Two key hormones play a crucial role in regulating sleep and wakefulness. Melatonin, the sleep hormone. Production and release. Melatonin is produced by the pineal gland in response to darkness. Its levels typically begin to rise in the evening, peaking in the middle of the night, and then declining in the morning. Effects on sleep. Melatonin promotes sleepiness, reduces alertness, and helps regulate the timing of sleep. Supplementation. Melatonin supplements can be helpful for some individuals with sleep problems, particularly those with delayed sleep phase syndrome or jet lag. However, it's important to consult with a healthcare professional before using melatonin supplements. Cortisol, the stress hormone. Production and release. Cortisol is produced by the adrenal glands and is involved in the body's stress response. Cortisol levels typically peak in the morning, promoting alertness and preparing us for the day. Effects on sleep. Elevated cortisol levels in the evening can interfere with sleep. Chronic stress can lead to chronically elevated cortisol levels, which can disrupt sleep patterns. The cortisol awakening response, CAR. A natural increase in cortisol occurs shortly after waking up, known as the CAR. This helps us become alert and energized for the day. Disruptions to the circadian rhythm. Several factors can disrupt the circadian rhythm and lead to sleep problems. Shift work. Working irregular hours, particularly night shifts, can desynchronize the circadian rhythm. Jet lag. Traveling across multiple time zones can disrupt the circadian rhythm, causing difficulty adjusting to the new time zone. Social jet lag. Inconsistent sleep schedules between weekdays and weekends can create a form of social jet lag, making it difficult to maintain a regular sleep-wake cycle. Exposure to artificial light at night. As mentioned earlier, exposure to blue light from electronic devices in the evening can suppress melatonin production and disrupt sleep. Understanding the circadian rhythm and the factors that influence it is essential for optimizing sleep. By aligning our daily routines with our internal clock, we can promote healthy sleep patterns and improve our overall well-being. The following chapters will explore practical strategies for creating a personalized sleep sanctuary and maximizing the benefits of restorative sleep. Chapter 3. Stages of sleep and sleep architecture. Sleep isn't a uniform state of unconsciousness. Instead, it's a dynamic process comprised of distinct stages that cycle throughout the night. Understanding these stages and their specific functions is essential for appreciating the complexity of sleep and its restorative power. This chapter will delve into the different stages of sleep, collectively known as sleep architecture, and explore their importance for physical and cognitive restoration. Detailed explanation of NREM, N1, N2, N3, and REM sleep. There are two main types of sleep: non-rapid eye movement, NREM sleep, and rapid eye movement, REM sleep. NREM sleep is further divided into three stages. NREM Stage 1, N1. This is the transition phase between wakefulness and sleep. It's a light stage of sleep where you may feel drowsy and easily awakened. During N1, brain waves slow down from alpha waves, characteristic of relaxed wakefulness, to theta waves. Muscle activity decreases. You may experience hypnic jerks, sudden muscle twitches. This stage typically lasts only a few minutes. NREM Stage 2, N2. This is a deeper stage of sleep than N1, but still relatively light. During N2, brain waves continue to slow down, with the appearance of sleep spindles, bursts of rapid brain activity, and K-complexes, large, slow brain waves. Heart rate and body temperature decrease. You become less responsive to external stimuli. This stage occupies about 45 to 55% of total sleep time in adults. NREM Stage 3, N3. This is the deepest stage of sleep, also known as slow wave sleep, SWS, or delta sleep. During N3, brain waves are dominated by slow delta waves. Muscles are relaxed. It's difficult to awaken someone from this stage. This is the stage where most physical restoration occurs. N3 is more prominent in the first half of the night. REM sleep. This stage is characterized by rapid eye movements, increased brain activity, and muscle atonia, temporary muscle paralysis. During REM sleep, brain waves resemble those of wakefulness. Eyes move rapidly behind closed eyelids. Heart rate and breathing become irregular. Dreams are most vivid and memorable during this stage. This is the stage where most cognitive restoration, particularly memory consolidation, occurs. REM periods become longer as the night progresses. The importance of each sleep stage for physical and cognitive restoration. Each sleep stage plays a unique role in restoring our bodies and minds. NREM Stage 3, N3. Physical restoration. This deep sleep stage is crucial for physical repair and growth. Growth hormone is primarily released during N3, promoting tissue repair, muscle growth, and bone strengthening. Immune system function. N3 is important for immune system function and cytokine production. Energy restoration. This stage allows the body to conserve energy and replenish its stores. REM sleep, cognitive restoration. This stage is essential for memory consolidation. REM sleep plays a critical role in consolidating memories, transferring them from short-term to long-term storage. Emotional processing. REM sleep may be involved in processing emotions and regulating mood. Creativity and problem-solving. Some research suggests that REM sleep can enhance creativity and problem-solving abilities. How sleep architecture changes with age. Sleep architecture changes significantly throughout the lifespan. Infancy. Newborns spend a large portion of their sleep in REM sleep, which is essential for brain development. They also have shorter sleep cycles. Childhood. The amount of deep sleep, N3, is highest during childhood, reflecting the importance of physical growth and development. Adolescence. Sleep patterns shift during adolescence, often leading to a later sleep onset and wake time. Adulthood. The proportion of deep sleep, N3, gradually declines with age, while the amount of time spent in lighter sleep stages increases. Older adults may also experience more frequent awakenings during the night. Understanding the different sleep stages and how they cycle throughout the night provides valuable insights into the importance of getting sufficient and quality sleep. By prioritizing sleep and creating a sleep-conducive environment, we can maximize the restorative benefits of each sleep stage and improve our overall health and well-being. The following chapters will provide practical strategies for achieving this. Chapter 4. Establishing a consistent sleep schedule. Consistency is key when it comes to sleep. Just as our bodies thrive on regular meal times and exercise routines, they also benefit immensely from a consistent sleep schedule. This chapter will provide practical strategies for creating and maintaining a regular sleep-wake cycle, a cornerstone of good sleep hygiene. Determining your ideal sleep duration. While the common recommendation is 7 to 9 hours of sleep for most adults, individual needs can vary. Determining your ideal sleep duration is crucial for optimizing your sleep schedule. Listen to your body. Pay attention to how you feel when you wake up naturally, without an alarm. If you consistently feel refreshed and alert after a certain amount of sleep, that's likely your ideal duration. Consider daytime function. If you feel excessively tired, sluggish, or have difficulty concentrating during the day, you may not be getting enough sleep. Experiment on weekends. Carefully on a weekend when you don't have obligations, allow yourself to sleep until you wake up naturally. This can provide insights into your natural sleep duration. However, be cautious not to drastically oversleep, as this can disrupt your sleep schedule. Age considerations. Sleep needs change throughout life. Children and adolescents require more sleep than adults, while older adults may experience changes in their sleep patterns and require slightly less sleep. Setting consistent bedtimes and wake-up times, even on weekends. Once you've determined your ideal sleep duration, the next step is to establish consistent bedtimes and wake-up times. This is arguably the most important element of establishing a healthy sleep routine. Regularity is paramount. Going to bed and waking up at the same time every day, even on weekends, helps to regulate your circadian rhythm and reinforce your body's natural sleep-wake cycle. Avoid catching up on sleep. While it might be tempting to sleep in late on weekends to catch up on lost sleep, this can disrupt your sleep schedule and make it harder to fall asleep on Sunday night, leading to a phenomenon known as social jet lag. Start small and be patient. If you're currently struggling with an irregular sleep schedule, don't try to make drastic changes overnight. Start by gradually adjusting your bedtime and wake-up time by 15 to 30 minutes each day until you reach your desired schedule. Strategies for shifting sleep schedules gradually. Shifting your sleep schedule, whether due to a change in work hours or simply wanting to become a morning person, requires a gradual approach. Chronotherapy. This technique involves gradually delaying your bedtime and wake-up time by 1 to 2 hours each day until you reach your desired schedule. This is often used to treat delayed sleep phase syndrome. Light therapy. Using a light box in the morning can help to advance your circadian rhythm and make it easier to wake up earlier. Conversely, avoiding bright light in the evening can help to delay your circadian rhythm. Melatonin supplementation. With caution, melatonin supplements can be helpful for shifting your sleep schedule, particularly when combined with light therapy. However, it's important to consult with a healthcare professional before using melatonin, as the timing and dosage are crucial. Dealing with shift work and jet lag. Shift work and jet lag can significantly disrupt the circadian rhythm and make it challenging to maintain a consistent sleep schedule. Shift work strategies. Consistent sleep-wake times on days off. Even on days off, try to maintain a sleep schedule that is as close as possible to your work schedule. Strategic napping. Short naps during breaks can help to improve alertness during night shifts. Light management. Use blackout curtains to create a dark sleep environment during the day and use bright light exposure during work shifts to promote alertness. Melatonin. With caution, melatonin can be helpful for adjusting to night shifts, but timing is crucial. Consult with a healthcare professional for guidance. Jet lag strategies. Adjust gradually before travel. If possible, start adjusting your sleep schedule a few days before your trip by shifting your bedtime and wake-up time towards the destination's time zone. Light exposure. Use light exposure strategically upon arrival at your destination. Seek bright light in the morning to advance your circadian rhythm and avoid bright light in the evening to delay it. Melatonin, with caution. Melatonin can be helpful for reducing jet lag, particularly when taken in the evening at your destination's time zone. Hydration and light exercise. Staying hydrated and engaging in light exercise can also help to alleviate jet lag symptoms. Establishing a consistent sleep schedule is a fundamental step towards improving sleep quality and overall well-being. By following the strategies outlined in this chapter, you can take control of your sleep and create a solid foundation for a restful and restorative sleep experience. Chapter 5. Crafting a relaxing bedtime routine. A consistent bedtime routine is like a gentle nudge for your body and mind, signaling that it's time to wind down and prepare for sleep. Just as a pre-flight checklist prepares a pilot for takeoff, a well-crafted bedtime routine prepares you for a smooth and restful night. This chapter will explore the importance of a relaxing pre-sleep ritual and provide practical tips for creating one that works for you. The importance of winding down before bed. In today's fast-paced world, it's easy to go from a state of high activity to trying to fall asleep instantly. However, this abrupt transition can make it difficult for your body and mind to relax and enter a state conducive to sleep. Winding down is essential for slowing down brain activity. A relaxing routine helps to shift your brain from active, beta waves to slower alpha and theta waves, which are associated with relaxation and drowsiness. Lowering stress hormones. Winding down helps to reduce levels of cortisol and adrenaline, stress hormones that can interfere with sleep. Promoting relaxation. A consistent routine can help to trigger a conditioned response, signaling to your body that it's time to sleep. Relaxation Technikquiz. Several relaxation techniques can be incorporated into your bedtime routine. Deep breathing exercises. Deep, slow breaths can help to activate the parasympathetic nervous system, which promotes relaxation and reduces stress. Techniques like diaphragmatic breathing or 4-7-8 breathing can be particularly effective. Meditation and mindfulness. Meditation and mindfulness practices can help to calm the mind and reduce racing thoughts, making it easier to fall asleep. Apps and guided meditations can be helpful for beginners. Progressive muscle relaxation, PMR. This technique involves tensing and then releasing different muscle groups in the body, promoting physical relaxation and reducing muscle tension. Gentle stretching or yoga. Light stretching or gentle yoga poses can help to release physical tension and promote relaxation. Avoid strenuous exercise close to bedtime. Calming activities. In addition to relaxation techniques, certain activities can help to create a relaxing atmosphere before bed. Warm baths or showers. A warm bath or shower can help to relax muscles and lower body temperature, signaling to the body that it's time to sleep. Reading. Reading a physical book, not on an electronic device, can be a relaxing way to wind down. Choose light, enjoyable reading material rather than anything stimulating or stressful. Listening to calming music or nature sounds. Soothing music or nature sounds can help to create a relaxing atmosphere and promote sleep. Journaling. Writing down your thoughts and feelings can help to clear your mind and reduce stress before bed. What to avoid before bed. Certain substances and activities can interfere with sleep and should be avoided in the hours leading up to bedtime. Screens. Blue light. The blue light emitted from electronic devices like smartphones, tablets, and computers can suppress melatonin production and make it harder to fall asleep. Avoid screen use for at least an hour or two before bed. Consider using blue light filters or night mode settings if you must use screens. Caffeine. Caffeine is a stimulant that can interfere with sleep. Avoid caffeine consumption in the afternoon and evening. Alcohol. While alcohol may initially make you feel drowsy, it can disrupt sleep later in the night, leading to fragmented sleep and poor sleep quality. Large meals or spicy foods. Eating a large meal or spicy foods close to bedtime can cause indigestion and discomfort, making it difficult to fall asleep. Strenuous exercise. While regular exercise is beneficial for sleep, avoid intense workouts close to bedtime, as they can be stimulating. Creating your personalized routine. There's no one-size-fits-all approach to creating a bedtime routine. The key is to find what works best for you. Consistency is key. Aim to follow your routine consistently every night, even on weekends. Start small and be patient. Don't try to implement too many changes at once. Start with a few simple activities and gradually add more as needed. Experiment and adjust. Pay attention to how different activities affect your sleep and adjust your routine accordingly. By crafting a relaxing and consistent bedtime routine, you can create a powerful signal for your body and mind, preparing you for a restful and restorative night's sleep. This consistent approach will set the stage for better sleep and improved overall well-being. Chapter 6. Optimizing your sleep environment. Your bedroom should be your sanctuary, a haven designed for rest and rejuvenation. The physical environment plays a crucial role in sleep quality. Even with a consistent sleep schedule and relaxing bedtime routine, a poorly optimized sleep environment can sabotage your efforts. This chapter will explore how to transform your bedroom into a sleep-conducive space, maximizing your chances of a restful night. Creating a dark, quiet, and cool bedroom. These three elements, darkness, quiet, and coolness, are fundamental for creating an optimal sleep environment. Darkness, light exposure, especially blue light from electronic devices, suppresses melatonin production and disrupts the circadian rhythm. Blackout curtains or shades. Invest in blackout curtains or shades to block out all external light sources, including streetlights, moonlight, and early morning sunlight. Eliminate light sources. Cover or remove any electronic devices with glowing lights, such as alarm clocks, chargers, and televisions. Eye masks. If you can't completely control the light in your environment, consider using a comfortable eye mask. Quiet. Noise pollution can disrupt sleep, even if you don't fully awaken. Earplugs. Use earplugs to block out noise from traffic, neighbors, or snoring partners. White noise machines or fans. A white noise machine or fan can create a consistent background sound that masks other noises. Soundproofing. If possible, consider soundproofing your bedroom by using thick curtains, rugs, and weather stripping around doors and windows. Cool. A slightly cool room temperature is ideal for sleep. Ideal temperature. The ideal bedroom temperature for most people is between 60 to 67 degrees Fahrenheit, 15 to 19 degrees Celsius. Adjust thermostat. Adjust your thermostat accordingly. Bedding. Use breathable bedding that helps regulate body temperature. Choosing the right mattress, pillows, and bedding. The right mattress, pillows, and bedding can significantly impact sleep comfort and quality. Mattress. Support and comfort. Choose a mattress that provides adequate support for your spine and is comfortable for your sleeping position, back, side, or stomach. Types of mattresses. Consider different mattress types, such as inner spring, memory foam, latex, or hybrid, and choose one that suits your preferences and needs. Replacing your mattress. Replace your mattress every 7 to 10 years, or sooner if it shows signs of wear and tear. Pillows. Support for head and neck. Choose a pillow that provides proper support for your head and neck, keeping your spine aligned. Sleeping position. Consider your sleeping position when choosing a pillow. Side sleepers typically need thicker pillows than back or stomach sleepers. Pillow materials. Different pillow materials, such as down, memory foam, or latex, offer varying levels of support and comfort. Bedding. Breathable fabrics. Choose bedding made from breathable fabrics, such as cotton, linen, or bamboo, to regulate body temperature and prevent overheating. Comfort and personal preference. Choose bedding that feels comfortable and inviting to you. The importance of good ventilation and air quality. Good ventilation and air quality are often overlooked but are essential for a healthy sleep environment. Ventilation. Proper ventilation ensures a fresh supply of oxygen and helps to regulate temperature and humidity. Open windows. When possible, open windows for a short period each day to air out the room. Use a fan. A fan can help to circulate air and improve ventilation. Air quality. Poor air quality can irritate the respiratory system and disrupt sleep. Air purifiers. Consider using an air purifier to remove allergens, dust, and other pollutants from the air. Indoor plants. Some indoor plants can help to improve air quality, minimizing noise and light pollution. Beyond the basics of darkness and quiet, consider minimizing other sources of noise and light pollution. Electronics. Keep electronic devices out of the bedroom or at least turn them off completely. Light from electronics. Cover or dim any remaining lights from electronics. Outside noise. Address any outside noise issues, such as traffic or noisy neighbors, by using earplugs, white noise machines, or soundproofing measures. By optimizing your sleep environment, you create a dedicated space for rest and rejuvenation. This investment in your sleep sanctuary will pay dividends in improved sleep quality, leading to enhanced physical and mental well-being. Chapter 7. The Power of Daytime Habits. While creating a relaxing bedtime routine and optimizing your sleep environment are crucial for good sleep, your daytime habits also play a significant role in determining how well you sleep at night. This chapter will explore the powerful connection between your daytime behaviors and your sleep quality, providing practical guidance on how to cultivate daytime habits that promote restful sleep. The impact of exercise, diet, and hydration on sleep. Your lifestyle choices during the day have a direct impact on your sleep at night. Exercise. Regular physical activity is beneficial for both physical and mental health, and it can also improve sleep quality. Timing is key. Aim to exercise earlier in the day, as exercising too close to bedtime can be stimulating and make it harder to fall asleep. Type of exercise. Both aerobic exercise, e.g., running, swimming, and resistance training, e.g., weightlifting, can improve sleep. Consistency. Consistent exercise is more effective than sporadic workouts. Diet. What you eat and when you eat it can affect your sleep. Balanced diet. A balanced diet rich in fruits, vegetables, whole grains, and lean protein supports overall health and can contribute to better sleep. Avoid large meals before bed. Eating a large meal close to bedtime can cause indigestion and discomfort, making it difficult to fall asleep. Limit processed foods, sugar, and saturated fats. These foods can disrupt sleep and contribute to poor health. Hydration. Staying properly hydrated is essential for overall health and can also impact sleep. Drink plenty of water during the day. Dehydration can lead to headaches, fatigue, and other symptoms that can interfere with sleep. Limit fluids before bed. While staying hydrated is important, avoid drinking large amounts of fluids close to bedtime to minimize nighttime bathroom trips. The importance of sunlight exposure during the day. Sunlight is the primary regulator of our circadian rhythm. Getting sufficient sunlight exposure during the day is crucial for maintaining a healthy sleep-wake cycle. Sunlight and melatonin. Exposure to natural light in the morning suppresses melatonin production and promotes alertness, while darkness triggers melatonin release in the evening, preparing the body for sleep. Time of day. Aim for at least 30 minutes of sunlight exposure in the morning, ideally within the first hour of waking up. Seasonal affective disorder, SAD. For individuals who experience SAD, a type of depression linked to reduced sunlight exposure in the winter months, light therapy can be particularly beneficial. Managing stress and anxiety. Stress and anxiety are common culprits of sleep problems. Developing effective stress management techniques can significantly improve sleep quality. Stress management techniques. Mindfulness and meditation. Practicing mindfulness and meditation can help to calm the mind and reduce stress. Deep breathing exercises. Deep breathing techniques can activate the parasympathetic nervous system, promoting relaxation. Yoga and Tai Chi. These practices combine physical movement with mindfulness and can help to reduce stress and improve sleep. Time management and organization. Effective time management and organization can help to reduce feelings of overwhelm and stress. Spending time in nature. Spending time outdoors can have a calming effect and reduce stress levels. The effects of caffeine and alcohol on sleep. Caffeine and alcohol are two substances that can significantly impact sleep. Caffeine. Stimulant effects. Caffeine is a stimulant that can interfere with sleep, making it harder to fall asleep and reducing sleep quality. Half-life. Caffeine has a half-life of about 5 to 6 hours, meaning it takes that long for half of the caffeine consumed to be eliminated from the body. Timing. Avoid caffeine consumption in the afternoon and evening. Alcohol. Initial sedative effect. Alcohol can initially make you feel drowsy, but it disrupts sleep later in the night. Sleep fragmentation. Alcohol can lead to fragmented sleep, frequent awakenings, and reduced REM sleep. Avoid before bed. It is best to avoid alcohol consumption close to bedtime. By incorporating these daytime habits into your lifestyle, you can create a strong foundation for restful sleep. These practices work synergistically with a consistent sleep schedule, a relaxing bedtime routine, and a sleep-optimized environment to create a holistic approach to sleep health. Chapter 8. Tracking your sleep and identifying patterns. Just as a doctor uses diagnostic tools to assess a patient's health, tracking your sleep allows you to gain valuable insights into your own sleep patterns and identify potential problems. This chapter will provide guidance on how to monitor your sleep, interpret the data, and recognize signs that may indicate a sleep disorder. Using sleep diaries and wearable sleep trackers. Two primary methods can be used to track your sleep: sleep diaries and wearable sleep trackers. Sleep diaries. A sleep diary is a simple but effective tool for recording information about your sleep. It typically includes bedtime and wake-up time. Record the exact time you go to bed and wake up. Time taken to fall asleep. Estimate how long it takes you to fall asleep after getting into bed. Number of awakenings during the night. Note how many times you wake up during the night and how long you stay awake. Wake-up time after final awakening. Record the time you wake up in the morning and do not go back to sleep. Daytime activities and habits. Note any factors that may have influenced your sleep, such as caffeine or alcohol consumption, exercise, stress, or unusual events. How you feel upon waking. Describe how you feel when you wake up, e.g., refreshed, tired, groggy. Daytime sleepiness. Note any instances of daytime sleepiness or fatigue. Keeping a sleep diary for a week or two can provide valuable information about your typical sleep patterns. Wearable sleep trackers. Wearable devices, such as smartwatches and fitness trackers, use actigraphy, measuring movement, to estimate sleep duration, sleep stages, and other sleep metrics. Advantages. Wearable trackers can provide objective data about your sleep, including total sleep time, sleep efficiency, percentage of time spent asleep while in bed, and sleep stage distribution. Limitations. While wearable trackers can be helpful, they are not as accurate as polysomnography, a comprehensive sleep study conducted in a sleep lab. They primarily estimate sleep based on movement, and may not accurately distinguish between different sleep stages. Using data wisely. Use the data from wearable trackers as a general guide and look for trends over time, rather than focusing on specific numbers. Interpreting sleep data and identifying patterns. Once you have gathered data from your sleep diary or wearable tracker, it's important to interpret the information and identify any patterns. Look for consistent bedtime and wake-up times. Are you maintaining a regular sleep schedule? Sleep duration. Are you consistently getting enough sleep? Sleep efficiency. Are you spending a high percentage of time in bed actually asleep? Sleep latency. How long does it typically take you to fall asleep? Nighttime awakenings. Are you experiencing frequent awakenings during the night? Daytime sleepiness. Are you feeling excessively tired or sleepy during the day? Correlations with daytime activities. Are there any correlations between your daytime activities, e.g., caffeine consumption, exercise, stress, and your sleep quality? Recognizing signs of sleep disorders. Tracking your sleep can help you recognize potential signs of a sleep disorder. Some common signs include difficulty falling asleep, insomnia, regularly taking more than 30 minutes to fall asleep, frequent awakenings during the night, waking up multiple times during the night and having difficulty falling back asleep, early morning awakenings, waking up too early in the morning and being unable to go back to sleep, excessive daytime sleepiness, feeling excessively tired or sleepy during the day, even after getting enough sleep, loud snoring and gasping for air, sleep apnea, snoring loudly and experiencing pauses in breathing during sleep, uncomfortable sensations in the legs and an urge to move them, restless leg syndrome, experiencing uncomfortable sensations in the legs, often accompanied by an irresistible urge to move them, particularly in the evening or at night, sudden daytime sleep attacks, narcolepsy, experiencing sudden and uncontrollable episodes of daytime sleepiness. If you are experiencing any of these symptoms, it's important to consult with a healthcare professional or sleep specialist for a proper diagnosis and treatment. Tracking your sleep data can provide valuable information for your doctor. By actively tracking your sleep and identifying patterns, you can take a proactive approach to improving your sleep health. This information can help you make informed decisions about your sleep habits and seek professional help if necessary. Chapter 9. Common sleep disorders and solutions. While many people experience occasional nights of poor sleep, some individuals suffer from persistent sleep problems that can significantly impact their health and well-being. These persistent issues may indicate a sleep disorder. This chapter will address some of the most common sleep disorders and explore effective solutions for managing them. Insomnia, causes, types, and treatment options. Insomnia is a common sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. Causes. Insomnia can be caused by a variety of factors, including stress and anxiety, poor sleep habits, underlying medical conditions, certain medications, changes in sleep schedule, e.g., jet lag, shift work. Types: acute insomnia, short-term insomnia that lasts for a few days or weeks, often triggered by a stressful event. Chronic insomnia, long-term insomnia that occurs at least 3 nights per week for 3 months or more. Treatment options: cognitive behavioral therapy for insomnia, CBT-I. CBT-I is a highly effective therapy that addresses the underlying causes of insomnia by changing negative thoughts and behaviors related to sleep. It includes techniques such as sleep restriction, stimulus control, and relaxation training. Medication: in some cases, medication may be prescribed to treat insomnia. However, medication should be used with caution and under the guidance of a healthcare professional, as some medications can have side effects and lead to dependence. Good sleep hygiene practices: implementing good sleep hygiene practices, as discussed in previous chapters, is essential for managing insomnia. Sleep apnea, types, symptoms, and treatment options. Sleep apnea is a sleep disorder characterized by repeated pauses in breathing during sleep. Types: obstructive sleep apnea, OSA the most common type, caused by a blockage of the upper airway during sleep. Central sleep apnea, CSA, a less common type, caused by a problem with the brain's signals that control breathing. Symptoms: loud snoring, gasping for air during sleep, frequent awakenings, excessive daytime sleepiness, morning headaches, difficulty concentrating. Treatment options: continuous positive airway pressure, CPAP. CPAP therapy involves wearing a mask that delivers continuous airflow to keep the airway open during sleep. It is the most effective treatment for OSA. Lifestyle changes: lifestyle changes such as weight loss, avoiding alcohol and sedatives before bed, and sleeping on your side can help to improve mild cases of OSA. Oral appliances: oral appliances can help to keep the airway open by repositioning the jaw and tongue. Surgery: in some cases, surgery may be recommended to correct structural problems in the airway. Restless leg syndrome, RLS symptoms and management strategies. Restless leg syndrome, RLS, is a neurological disorder characterized by uncomfortable sensations in the legs, often described as itching, crawling, or pulling, accompanied by an irresistible urge to move them. Symptoms: uncomfortable sensations in the legs, typically occurring in the evening or at night. An irresistible urge to move the legs. Symptoms worsen during periods of inactivity. Symptoms are relieved by movement. Management strategies: lifestyle changes ***, regular exercise, avoiding caffeine and alcohol, and establishing a regular sleep schedule can help to manage RLS symptoms. Iron supplementation ***, iron deficiency can contribute to RLS, so iron supplementation may be recommended in some cases. Medications ***, certain medications can be effective in treating RLS symptoms. Narcolepsy, symptoms and treatment options. Narcolepsy is a neurological disorder that affects the brain's ability to regulate sleep-wake cycles. Symptoms: excessive daytime sleepiness, cataplexy, sudden loss of muscle tone triggered by strong emotions, sleep paralysis, inability to move or speak while falling asleep or waking up, hypnagogic hallucinations, vivid hallucinations that occur while falling asleep. Treatment options: medications. Medications can be used to manage the various symptoms of narcolepsy, such as daytime sleepiness and cataplexy. Lifestyle modifications: regular sleep schedules, planned naps, and avoiding alcohol and caffeine can help to manage symptoms. If you suspect you may have a sleep disorder, it's crucial to consult with a healthcare professional or sleep specialist. They can conduct a thorough evaluation, diagnose your condition, and recommend the most appropriate treatment plan for you. Early diagnosis and treatment can significantly improve your sleep quality and overall well-being. Chapter 10. Sleep and Special Populations. While the principles of good sleep hygiene apply to everyone, sleep needs and challenges can vary significantly across different life stages and circumstances. This chapter will address the unique sleep considerations for specific populations, including children and adolescents, pregnant and postpartum women, older adults, and individuals with chronic health conditions. Sleep in children and adolescents. Children and adolescents have different sleep needs and patterns compared to adults. Children. Higher sleep needs. Children require more sleep than adults, with newborns needing up to 17 hours, preschoolers needing 10 to 13 hours, and school-aged children needing 9 to 11 hours. Sleep patterns. Young children often have irregular sleep patterns and may take naps during the day. As they get older, their sleep patterns become more regular. Bedtime routines. Establishing consistent bedtime routines is crucial for children. These routines should be calming and predictable, including activities such as a warm bath, reading a story, and brushing teeth. Sleep problems. Common sleep problems in children include bedtime resistance, night wakings, and sleep terrors. Adolescence. Shift in circadian rhythm. During adolescence, the circadian rhythm naturally shifts, leading to a later sleep onset and wake time. This is often referred to as phase delay. Increased sleep needs. Adolescents still require a significant amount of sleep, typically 8 to 10 hours per night. Impact of technology. The use of electronic devices, particularly in the evening, can further disrupt sleep patterns in adolescents. School start times. Early school start times can make it difficult for adolescents to get enough sleep. Sleep during pregnancy and postpartum. Pregnancy and the postpartum period bring significant hormonal and physical changes that can affect sleep. Pregnancy. First trimester. Increased fatigue and sleepiness are common in the first trimester due to hormonal changes. Second trimester. Sleep may improve in the second trimester. Third trimester. Physical discomfort, frequent urination, and heartburn can make it difficult to sleep in the third trimester. Sleeping positions. Sleeping on the left side is recommended during the third trimester to improve blood flow to the fetus. Postpartum. Sleep deprivation. New mothers often experience significant sleep deprivation due to caring for a newborn. Hormonal changes. Hormonal fluctuations can also contribute to sleep problems. Strategies. Strategies such as napping when the baby sleeps, sharing nighttime duties with a partner, and creating a relaxing sleep environment can help to improve sleep. Sleep in older adults. Sleep patterns change naturally with age. Changes in sleep architecture. Older adults tend to have less deep sleep, N3, and more frequent awakenings during the night. Reduced sleep efficiency. Sleep efficiency, the percentage of time spent asleep while in bed, tends to decrease with age. Increased daytime napping. Older adults may take more naps during the day. Underlying medical conditions. Older adults are more likely to have underlying medical conditions that can affect sleep, such as arthritis, heart disease, and respiratory problems. Sleep and chronic health conditions. Many chronic health conditions can impact sleep quality. Pain conditions. Chronic pain conditions, such as arthritis and fibromyalgia, can make it difficult to fall asleep and stay asleep. Respiratory conditions. Conditions such as asthma and chronic obstructive pulmonary disease, COPD, can cause breathing difficulties that disrupt sleep. Cardiovascular conditions. Heart disease and other cardiovascular conditions can affect sleep. Mental health conditions. Mental health conditions such as depression and anxiety are often associated with sleep problems. Managing the underlying health condition is crucial for improving sleep. Working closely with healthcare providers to develop a comprehensive treatment plan that addresses both the health condition and sleep problems is essential. Understanding the unique sleep needs and challenges of these special populations is crucial for providing appropriate support and guidance. By addressing these specific needs, we can help individuals at all life stages achieve better sleep and improve their overall quality of life. Chapter 11. Maintaining long-term sleep health. Improving your sleep is not a one-time fix, it's an ongoing journey. This chapter will provide strategies for sustaining good sleep habits over time, adapting to life changes, prioritizing sleep as part of a healthy lifestyle, and recognizing when to seek professional help. Adapting sleep routines to life changes. Life is full of changes, and these changes can often disrupt our sleep. It's important to be flexible and adapt your sleep routines as needed. Changes in work schedules, new jobs, shift work changes, or increased work demands can impact your sleep schedule. Gradually adjust your bedtime and wake-up times to align with your new schedule. If you are working shifts, be sure to implement the strategies mentioned in Chapter 4. Travel. Traveling across time zones can disrupt your circadian rhythm. Use the strategies for dealing with jet lag discussed in Chapter 4. changes in family dynamics, the arrival of a new baby, children moving out, or caring for elderly parents can all impact sleep. Adjust your routines and seek support as needed. Stressful life events. Major life events, such as moving, changing jobs, or experiencing a loss, can cause stress and disrupt sleep. Prioritize stress management techniques and seek support if needed. Prioritizing sleep as part of a healthy lifestyle. Making sleep a priority is essential for maintaining long-term sleep health. View sleep as an investment in your overall well-being, not a luxury. Integrate sleep into your daily routine. Schedule time for sleep just as you would for other important activities, such as work, exercise, and meals. Practice good sleep hygiene consistently. Consistently adhere to the sleep hygiene practices discussed throughout this book, including maintaining a regular sleep schedule, creating a relaxing bedtime routine, and optimizing your sleep environment. Be mindful of daytime habits. Continue to practice healthy daytime habits, such as regular exercise, a balanced diet, adequate hydration, and stress management techniques. Avoid all-nighters. Avoid pulling all-nighters whenever possible, as they can significantly disrupt your sleep schedule and have negative consequences for your health. Seeking professional help when needed. While many sleep problems can be managed with lifestyle changes and good sleep hygiene practices, some require professional intervention. When to seek help? Consult a healthcare professional or sleep specialist if you experience persistent difficulty falling asleep or staying asleep, excessive daytime sleepiness, loud snoring, gasping for air, or pauses in breathing during sleep, uncomfortable sensations in your legs accompanied by an urge to move them, sudden daytime sleep attacks or cataplexy, sleep problems that significantly impact your daily life. Types of professionals. Primary care physician. Your primary care physician can provide initial assessment and referral to a sleep specialist if needed. Sleep specialist, somnologist. A sleep specialist is a physician who specializes in the diagnosis and treatment of sleep disorders. Sleep psychologist. A sleep psychologist can provide cognitive behavioral therapy for insomnia, CBT-I, and other psychological interventions for sleep problems. Sleep studies. A sleep study, also known as polysomnography, is a comprehensive test that monitors various physiological parameters during sleep, such as brain waves, eye movements, muscle activity, heart rate, and breathing. Sleep studies are used to diagnose various sleep disorders. Maintaining long-term sleep health requires ongoing effort and attention. By adapting your routines to life changes, prioritizing sleep as part of a healthy lifestyle, and seeking professional help when needed, you can ensure that you continue to reap the many benefits of restorative sleep for years to come. Remember, consistent effort is key to building and maintaining your sleep sanctuary.